Prior to Sandy hitting Ocean County and making landfall here, that whole weekend we were staging assets and getting them ready and moving them around the county to where they may be needed. We moved our medical needs shelter trailer to a local facility that would be set up if needed as a medical needs shelter for those residents. And that's something we learned from Hurricane Irene last year. We modified a lot of different things that we were working with and really looking at trying to change our scope to some degree while still assuring the essential service of public health and food safety, water safety, and personal health safety. Many of the challenges, and I give the staff a tremendous amount of credit. I mean, we did a 24/7 operation for about a week in terms of the medical needs shelter. We had people coming out at all hours of the day. We had 6-hour shifts throughout the day, and we had people relieving each other through the nighttime and showing up at 2 a.m. and midnight, and it was really a concerted, great effort. Now we have a number of nurses that we have on staff, full-time, part-time, and seasonal. We're also active in our flu vaccination campaign, so we have some additional seasonal flu nurses as well. But we also had some nurses that are just showing up at the medical needs shelter looking to volunteer. And while that's well-intentioned, we have to, from a governmental perspective and an organizational perspective, assure that the people showing up have the credentials that they're talking about. So managing volunteers in an event like that was extremely difficult and frustrating, and expressing to the staff that are on the front line and dealing with some of these issues. And so we modified some of our process to be able to screen and bring volunteers in to assist with the operations after we were able to verify credentials. There are many organizations that we partner with on a day-to-day basis, and we communicate with them, we exercise our plans, we discuss our plans with them, and I think it really shows, and it's a testament in terms of the response, in terms of moving ahead, because it is a concerted effort. When you're looking at bringing together government agencies and some of the other nonprofits that are out there, as well as some for-profits that are out there as well, bringing it all together and really looking at trying to put the best response together and trying to meet the needs of what the residents of Ocean County have. So when you're looking at developing a shelter and setting up that shelter operation, working with some of the local organizations and trying to make accommodations, if people are going to be evacuating, where the recommendation is to evacuate, they don't want to leave their pet behind. So 2 of the 3 county shelters were actually pet-friendly shelters that they could have arrived at that shelter with their dog or the cat. And we had some other exotic animals. You'd be surprised at what had shown up at the shelter. But I think it helps in the message that you're hearing what their needs are, and you're planning and taking those needs into consideration in the planning to be able to meet those needs. The thing I'm probably most proud of is really the response of the staff and really trying to deal with not only what their job is here within the agency, but also looking at addressing it and dealing with their personal issues and the personal impact of Sandy, putting that on side. Many people postpone fixing things at their own home and addressing things within their own family for several days, a week, or even 2 weeks, just to be able to do their job and to really function and fit the need within the agency. And that, I think, is probably one of the most telling stories in terms of the staff, and really trying to meet the needs and really respond as an organization and moving ahead. I mean, you can have the best plan that's on paper, but if you don't have staff to be able to implement that plan, the plan is worthless.